So we have a clot busting medicine. Stroke and the heart attack cases are increasing in the younger age groups.
So the people who are in time can be saved at most of the cases.
Yes, the golden hours are the early treatment window of this stroke.
But these days, younger people like 30s and 40s, they have started facing strokes.
The World Health Organization guidelines is 4.5 hours. So basically, it's a stroke reversal treatment.
Good morning. We are here with Dr. Tarun Mathur today. He is a neurophysician from Paras Healthcare. Doctor is very renowned and has been dealing with a lot of cases of neurological disorders. So today we will be speaking about the major two concerns, stroke and migraine with him. Welcome, sir. Welcome to the show.
Good morning and thank you. And I am very glad that you have invited me to discuss these two important topics, which are nowadays a very serious health concern, particularly stroke. Stroke is a medical emergency in neurology. So it's a sudden disease. World Health Organization has given a short acronym to identify it. It is called as B FAST, where B stands for balance, E stands for eye, vision, F stands for facial weakness, A for arm weakness, and S for speech disturbances. Whenever someone has a constellation of these signs and symptoms, all of a sudden, it indicates that he is suffering from a brain stroke. And then comes the T, which is the time to intervene.
Okay.
So basically, it's a medical emergency. Strokes are of two kinds. The commonest is the ischemic stroke, which is basically a sudden cutoff of the blood supply to the brain.
Okay.
And the second, less common, is the hemorrhagic stroke, which is due to rupture of a brain artery. However, the signs and symptoms of both these kinds of strokes are quite similar. So, whenever somebody presents with these signs and symptoms, time is the major factor that plays into role.
Sir, this was a great insight about signs and symptoms of stroke. Now, these days, I've been seeing a trend shift in the stroke pattern also. Earlier, only older people used to get it. But these days, younger people like 30s and 40s, they have started facing strokes. What is the major reason to it?
Yeah, that's true. Nowadays, we are seeing stroke as common in the younger age groups, like 30s and 40s. As previously we used to see, and there was the understanding that stroke is only a disease of the old age groups. But nowadays, we are seeing young strokes also. There are multiple reasons for it. The commonest reason, which I believe, is the poor lifestyle and poor dietary habits, then increasing stress levels, and there is a hypothesis that post-COVID also, due to the increased thickness of the blood, the stroke and the heart attack cases are increasing in the younger age groups. So these are some of the common hypotheses which I believe are contributing to this trend shift from older age group to younger age group. Yesterday only I saw a fellow from Bihar who is working in Udaipur. He is in his early 40s. He presented with sudden weakness of the left half. It was fortunate that he came to us within a couple of hours, so we were able to give him a clot busting medicine, and he is doing fine now.
That's
So
great.
yes, there is a trend shift in the stroke age groups nowadays.
So, sir, now when you just say that he has come to the hospital in time, so is this something related to golden hour?
Yes.
And can you tell us a little more about golden hour?
Yes. So basically, the golden hours are the early treatment window of this stroke. As per the World Health Organization guidelines, it is 4.5 hours. So anybody who presents within this time interval, particularly the ischemic stroke patients, so we have a clot busting medicine called as thrombolytic drug, which can give in this time frame and dissolve the clot and restore the blood flow to the brain. So basically, it's a stroke reversal treatment.
So this is a life savior kind of a
Yes, life
thing.
savior, disability savior.
So the people who are in time can be saved at most of the cases.
Yes, if they come early in the time frame.
Sir, as you highlighted, that lifestyle has become a major issue these days, and people are really facing stroke and migraine issues because of lifestyle. So what lifestyle changes can people do?
So lifestyle changes basically mean regular exercise and following a healthy diet regime. Regular exercise means you have to spare at least 45 minutes for your exercise modules. Maybe if you are into cardio, you can go for a walk, you can go for a jog, you can go for a run, or if you are into gym training, you can go for that. But something has to be done for your body. And healthy diet means eating more of greens, avoiding processed foods, especially canned foods, eating more of veggies, more of fruits, more of nuts, like almonds. Almonds are very good antioxidants, good for brain, good for heart.
True,
So
true.
these kind of changes, and apart of that, you should give proper rest to your body.
Okay.
At least 7 to 8 hours of sound sleep is needed for
Wow.
a recovery of our body.
Okay.
So this much of sleep is mandatory if you
Okay.
want to prevent many of the lifestyle diseases which can account from these irregular habits.
Yes, and these days now I understand why the trend has shifted
Yes.
from older to younger, because youngers are either busy scrolling on the
Yeah.
phone, partying,
Yeah.
and their lifestyle is eating
Yes.
outside every
That is
day.
very common nowadays, which is
So,
also kind of accounting for the shifting
yes.
trend.
Yes, so definitely. Sir, is there any other medical advancement except the medicine for stroke which is there in near future or which has been already introduced?
Yeah. So apart from the clot busting medicine, there is a game changer in the stroke treatment. It is called
Okay.
as mechanical thrombectomy.
Okay.
It's a percutaneous procedure, same like the cardiologists have been doing stenting for the heart attack patients.
Yes, sir.
In this process, we go through a catheter and wire through a groin artery right up to the brain artery, and with the help of a stent retriever, we take out the clot.
Oh,
So
okay.
this can be offered to the patients who present to us beyond the 4.5 hours time window of
Okay.
acute stroke. And
Okay.
after initial imaging, we feel that there is a large artery which is occluded and it can be opened up.
Okay, so this is a very good advancement and a lifesaver for people who are a
Yes,
little late to identify the symptoms.
yes,
So, to conclude, would you like to highlight something about the stroke?
yes. So just to conclude, I would say that stroke is a medical emergency, and knowing a stroke is like saving a life. So you should know how to identify a stroke, and once you identify or spot a stroke, rush to the nearest stroke ready center.
Thank you so much, sir, for your insight,
Thank you.
for your time. Thank you
Thank
so
you.
much.
Thank you.